This is Health Week on News Talk 1480 WHBC, and today we're broadcasting live from OMNI Orthopaedics, and we've been talking about so many different things. By the way, phone number for you, 330-492-9200. Very easy to remember, 330-492-9200. That is the Canton location. There's also a Dover location, which is 330-602-3200. And as I said, we've been talking about different types of hip replacements, surgeries, and things like that. But let's talk a little bit about physical and occupational therapy. And we have with us right now Tim Lynn, who is the OMNI PT Clinic Manager. How are you, sir?
I'm very good. How are you?
I'm doing well, doing well. And I was talking with Tim off the air and saying that, you know, I went through physical therapy probably just one time in my life about 6 or 7 years ago. And it was here, and it was just the best thing that I ever did, and it saved me because I had terrible back issues. And if you've never gone through physical therapy, people say the words physical therapy, and you get this scared look on your face, like, what are they going to do to me? Right?
Right.
Yes.
Yeah, absolutely.
So take us through the process of, say a doctor here, refers them over to you in the physical therapy, says, okay, they need physical therapy. How does that work? What happens?
Yeah, so usually one of our physicians will go ahead and make that recommendation, either to try to manage a condition conservatively, like you were talking about, or post-operatively. Once the patient receives that referral, they come down to us and we get them on the schedule, and then they get a 1-hour meeting one-on-one with a physical therapist, and the physical therapist will go over their condition, their limitations, and then also find out what their goals are and what they would like to get out of therapy, and we'll build a treatment plan around that. Okay.
And normally it's obviously based on, getting them stronger.
It can be stronger, it can be range of motion, and it can also be pain reduction. Usually we find if you're restoring range of motion and strength, the pain starts to take care of itself over time.
Okay, and what kinds of things are usually treated in physical therapy?
So we see everything from your run-of-the-mill low back pain, neck pain, mid-back pain, postural deficits, to shoulder pain, elbow, wrist, hand, which our occupational therapists primarily handle, and then hip, knee, foot, and ankle. We work with athletes trying to get back to sport, and then we see all of our patients post-operatively as well after they've had surgery, either at one of the hospitals or at Oasis, our surgical center.
And I've also brought my mom here for physical therapy. So she's 86. And so you work with people who are elderly as well, right?
Yes, absolutely. So we see younger adults, we see kids, and we see older adults as well, all the way into their 90s, who are still active and trying to get back to their normal lifestyle.
So talk a little bit about some of the ways that you help folks.
Sure. So we look at each person individually, and we try to figure out what their deficits are, and then what they're trying to get out of therapy, and then we will design our program around that. And so we'll look at putting together progressive strengthening exercises that in the beginning might be more basic but still challenging for that particular person, and over time we kind of are able to look back and say, look at the exercises and things you're doing when you started, now look at the things you're doing today, kind of see how far you've come, those types of things. And then we'll incorporate manual therapy interventions along the way, which is a little bit more of a hands-on treatment-based approach, just depending on what the patient needs.
Now, we had talked to Dr. Bickett about stretching. She was saying how, that's something that she tells her patients all the time. Maybe you can talk a little bit about that and the benefits of that.
Yeah, so in general, we just want to make sure that we're maintaining mobility. So an injury risk comes when a joint or a body segment is taken beyond its physical limitations or its normal range of motion, and that's when you can injure a muscle or a tendon. And if you stretch particularly dynamically, which is moving while you're stretching, you're able to make that tissue a little bit more elastic over time and a little less susceptible to injury.
So when people come to you, and like I said when we first started talking, and they're afraid, you're not going to force them to do something that's going to hurt them, right?
No, and after surgery and things like that, a certain amount of pain is to always be expected, and that is part of the rehabilitation process, but part of our job is to help you manage that pain and understand the expectations and kind of gauge yourself. So we're pushing you to the point of where we know, okay, that's what you can tolerate, and then we can back down or move it up from there. In general, though, no, it's not the kind of just grab onto somebody and start moving things until they hurt, and those types of things that people think of kind of more from the older days. And now we take a little bit more of a progressive approach where we try to start off slow and work into it.
And how long usually do people have to go through physical therapy?
It varies a lot by person, but for a joint replacement, we'll see people anywhere from 4 to 8 weeks. A couple times a week is typical. For conservative management of condition, it really just depends on what their starting point is. We can sometimes see them just for a few times a week for a couple weeks, and they're good to go, and they can manage it on their own at home, and other folks need a little bit longer, and we're able to adapt.
All right. Tim Lynn, Doctor of Physical Therapy with OMNI's PT Clinic. We appreciate you coming on this morning.
Thank you for having me.
Thanks. All right, we're going to take a break for the news, and we'll be back after the bottom of the hour. We've got a lot more to talk about here at OMNI Orthopaedics during Health Week on 1480 WHBC.